Hi, I'm Dr Peta Stapleton, clinical and health psychologist here in Queensland, Australia, and I'm an associate professor in psychology at Bond University. Mostly I am known for my research in the area of EFT, emotional freedom techniques, or something that we call psychological acupuncture or just tapping. It describes the technique itself, which involves exposure therapy and a cognitive statement, and we stimulate pressure points on the body while focusing on some sort of distress. So this research spotlight is really to take some of the research that has been done out there and make it easy to understand. So you might feel like you want to share this with people just so that they can understand a little bit more about the evidence that is growing and the effectiveness, if you like, of EFT. But in particular today, what I want to talk about is a concept that is somewhat unique to EFT or tapping called borrowed benefits. And the reason why I want to talk about it is, whilst practitioners might be very familiar with it, we've actually investigated it and there is published research to prove that borrowed benefits indeed is a real thing and actually can be beneficial in your own work. So what is borrowed benefits? So the concept here, particularly if we work in groups, is that the facilitator of the group often will ask for a volunteer. Now, a volunteer could be anyone, and you could have a group of 5 people or 10 people or indeed 50. And what happens is normally the volunteer will come up the front and just work with that person who's the facilitator or the practitioner. Normally what we ask is that if everybody else might be thinking of their own particular issue and they may well have jotted that down. They might have even put a subjective unit of distress rating on their own concern. And then they just put that aside for the duration of obviously the volunteer up the front. Typically what happens is as everybody taps along, so the rest of the group would be encouraged to actually tap along just silently to themselves while the facilitator works with that volunteer up the front. And what happens is as they're obviously just supporting that person by doing their own tapping at the same time in the group, that when they get to the end of it and they recheck their own issue that they may have jotted down in front of them, that they'll often find a reduction, even though they may not have specifically been thinking about their own issue at that time. How this works and why we actually think that obviously the borrowed benefits concept actually works is that if there's any kind of connection, I guess, between whatever it was that was going on for you and the volunteer up in the front of the class or the group, if there's any connection between what it is that you held in the back of your mind, that you will actually obviously have some sort of impact or outcome on that as you're tapping along with their particular words. There's also the concept too of mirror neurons, and in the notes here is a link obviously to a TED talk that explains a little bit more about what mirror neurons are and why they fire when we watch someone else actually do something. Kind of dissolves the space, if you like, between us and them. So the link to that particular talk is there. But a lot of the times in clinical research, and it is driven by cost effectiveness, is that we run research trials in groups. So we, particularly here in Australia, when we do our research in the area of EFT or tapping for food cravings in overweight and obese adults, is we will run them in groups of 10 to 15. And we use this concept of borrowed benefits, where somebody will volunteer to actually have their food craving, and often it's in front of them, so we do exposure therapy with the facilitator up the front, and everybody else will tap along just with what they're saying out loud. What we find is they will get this benefit, if you like, this borrowed benefit of having their own food craving reduce in intensity and craving severity while they're actually tapping with the person up the front. So we certainly do apply this, but I want to talk about a couple of studies today that have actually investigated the whole concept of borrowed benefits at that kind of particular level. And if I start with one that was done, we had 216 healthcare workers who are attending a series. So they were at a workshop. So there were 5 workshops in the USA. Dr. Dawson Church is one of the authors of this. And again, the link is there if you want to read the full paper. So 5 workshops. 216 healthcare workers, and they were participating, but almost all of them in every kind of workshop was using this volunteer facilitator situation where they're up the front of the class or group, and everybody else was self-applying the EFT technique as they were watching and listening. So these healthcare workers were rated on symptoms of psychological distress, as well as things like anxiety and depression. And in the outcomes that were followed through on this study, there was significant reductions in all of those for the people that were tapping along with the volunteers up the front, and those effects were maintained. They've also looked at borrowed benefits using groups with returning war veterans and their spouses. So 218 war vets were involved in another study, and their spouses were as well. Again, using this concept of group therapy and having a facilitator or practitioner up the front with a volunteer and everybody else tapping with them. And again, significant reductions in post-traumatic stress disorder symptoms and levels of distress were reported, and certainly were still there upon follow-up. And then another paper that has actually come out in 2018 by Dr. Dawson Church and colleagues, again, has looked at this whole concept of borrowed benefits. They looked at 81 adults who actually attended 5 two-day workshops. So they were all around EFT. So obviously people that were coming along just to learn tapping. And again, it was the same thing where a facilitator asked for a volunteer up the front and everybody else self-applied as they were listening to that person talk about their own concern. So they measured these 81 adults on things like depression, anxiety, post-traumatic stress disorder symptoms, pain, and even food cravings and things like that. They did a 6-month follow-up on this particular group. They reported after their 2-day workshops a significant reduction in all of those symptoms and all of the gains that they made, except for one, which was the element of hostility that was measured in a measure. The hostility stayed the same, nothing changed there. But every other measure, anxiety, depression, pain, cravings, things like that, 6 months later was still significantly reduced just from this concept of borrowed benefits where they watched somebody else do the tapping up the front whilst they also tapped, obviously, on perhaps the words that were being said or used holding their own issue in the back of their head, that kind of thing. Again, all of our research, which is highlighted in another research spotlight on the food cravings and weight loss trials we have run here in Australia, all of them have been delivered at that group level. So again, this same type of concept. So there are papers that are published, the links are below, that particularly focus on borrowed benefits as a form of delivery rather than individual therapy, which obviously can be very different. And the fact that these papers are showing, and the research and statistics are showing, that the outcomes do happen and are maintained over time, that at least gives us some confidence in delivering these types of interventions in the group space, knowing that there is this unique kind of concept, if you like, of clients receiving that borrowed benefit as they follow along with a facilitator and a volunteer up the front. So I hope this has explained a little bit about the research that sits behind this concept, and that maybe you might be able to share this or indeed just include it in your work, that as well as doing individual client or patient work, that you may actually look to the whole idea of borrowed benefits in a group, cost effectiveness, and know that the outcomes will still be there for you. So I'm Dr. Peta Stapleton. It's been a pleasure sharing, and I hope this has been useful.